Going upstream dramatically cuts the cost of downstream reactions. Take Expedia. Almost 60% of their customers called support after booking, mostly over missing itineraries. That cost them a whopping $100 million a year. The upstream fix? Just making sure emails got through and itineraries were easy to find online. That slashed those calls way down to about 15%. Second, tackling big systemic problems means beating something called problem blindness, just accepting that bad outcomes are going to happen. Chicago Public Schools, for example, used to have really high dropout rates, but then researchers found a key predictor. Ninth graders on track with credits were 80% likely to graduate. Focusing on that freshman on track metric, it boosted graduation rates by over 25 percentage points. Pretty amazing. Finally, a big hurdle for upstream efforts is the wrong pocket problem. This happens when the group paying for the prevention isn't the one saving the money later on. Think healthcare. Your doctor is best placed to prevent illness, right? But often, they don't get paid much for prevention, even though it saves insurers like Medicare tons down the line. The incentives are just misaligned. Upstream victories are quiet but powerful, achieving massive, long-lasting good by changing the system's odds.
Factoring can meet the cash needs of small businesses struggling with tariffs. Contact Chris at Versant Funding to learn if your client is a factoring fit.
Called upstream thinking, specifically, what holds us back from doing more of it. So to really get us started, there's this great public health parable. Imagine you're by a river, maybe having a picnic, and suddenly you see a child in the water drowning. Of course, you jump in, you save the child, but then there's another one. And another. Soon, you and a friend are just pulling kids out, completely overwhelmed. Then your friend starts walking away upstream. You yell, "Hey, where you going? We need help here." And your friend calls back, "I'm going upstream to tackle the person who's throwing all these kids in the water."
Yeah, that parable just nails the core idea, doesn't it? It frames the choice perfectly. So let's define those terms. Downstream actions are like pulling the kids out, reacting to the crisis right in front of you. Essential, obviously. But upstream efforts, that's about going upstream, finding the root cause, preventing the problem from happening in the first place. And the sources we looked at, they show that going upstream is often, well, it's messy, it's harder to organize, but when it works, the results are just massive, long-lasting. So we'll explore the big barriers stopping us from getting there.
Okay, let's make this concrete. Let's talk about a really powerful example of the cost of not thinking upstream. The Expedia shock back in 2012. There was a guy, Ryan O'Neill, head of customer experience. He started looking at customer service calls not just as an expense line, but as a kind of symptom.
Exactly. And when he actually dug into the numbers, he found something pretty mind-blowing for an online company. Get this. For every 100 customers who successfully booked travel on Expedia, 58 of them, 58, called customer support afterwards for help.
Wow, 58%. For a website designed for self-service?
Yeah.
That's almost 2/3 of customers needing help after they bought something.
It's kind of staggering, right? It basically undermines the whole point of booking online. And traditionally, how did they handle it? Well, they managed the call center for efficiency, purely downstream.
So, like, how fast can we answer the call?
Right. How quickly can the rep solve the immediate issue? Minimize call time, minimize cost. O'Neill mentioned everyone was asking, can we make a 10-minute call, a 2-minute call? But his boss, Tucker Moody, pushed back with that crucial upstream question. Why 2 minutes? Why any minutes?
Ah, okay. Asking why the call was happening in the first place. So what did they find?
Well, they ranked the reasons, and the number one reason, driving something like 20 million calls a year, it was just people needing a copy of their itinerary.
20 million calls just for an itinerary.
Yeah. And at maybe $5 a call, you're looking at a $100 million annual problem. The root causes were pretty simple stuff. Customer mistyped their email, the confirmation went to spam, maybe they deleted it by accident, but the system failure was huge. There's no easy way on the website for customers to just retrieve their itinerary themselves.
And this is where the organizational structure kind of bites them, right?
Yeah.
The sources point out the system was almost perfectly designed to create this problem.
That's exactly right.
Yeah.
You had the product team incentivized to get bookings. So less friction, maybe only asked for the email once, which, increases the chance of typos. Then you have the support team incentivized just to handle calls quickly, downstream again.
So no one owned the prevention of the calls.
Nobody. No team was measured on making sure customers didn't need to call. So the upstream fix was conceptually simple. build a robust, easy-to-find self-service link for itineraries. And it worked. It basically wiped out those 20 million calls. The overall call rate dropped from that 58% down to around 15%. The win wasn't just saving money, it was fundamentally changing how they thought about success.
That's a great transition to the first major barrier we want to talk about, which the source is called problem blindness. This is that kind of fatalistic view that, bad things, whether it's high support costs or injuries, are just normal, unavoidable.
Oh, you see this everywhere, especially in fields like medicine or sports. Think about the New England Patriots football team. Before a performance expert named Marcus Elliott joined them, they were averaging something like 22 hamstring injuries per season. 22. And the attitude was basically, well, that's football. It just happens.
It's just part of the game, right?
Exactly. But Elliott didn't accept that. He came in with a really sophisticated data-driven prevention program, tailored to each player. Pure upstream thinking, the result. The next season, hamstring injuries plummeted, down to just 3.
Wow. From 22 to 3. So the system wasn't inevitable, it was the mindset that was stuck.
Precisely. They were waiting downstream for the injury to happen instead of going upstream to prevent it. And this blindness, it's not just organizational, it's deeply cognitive too. There's a fascinating concept called inattentional blindness. There was this famous study, you might have heard of it. Researchers gave radiologists chest CT scans to review, looking for cancerous nodules. Really focused task. But they secretly inserted a tiny image of a gorilla into the scan slides.
A gorilla?
Seriously? Yep, a little gorilla. And get this, out of 24 expert radiologists, 20 of them, 20, completely missed the gorilla. Their intense focus on finding the cancer made them literally blind to something completely obvious but unexpected.
So focusing too hard on the immediate problem can actually prevent you from seeing other things. Yeah. Even a gorilla on a CT scan.
Which leads right into this related idea of tunneling.
Exactly. Tunneling is what happens when you're under pressure. Experiencing scarcity could be time, money, even just mental bandwidth.
Yeah.
You focus very narrowly on the most urgent crisis right in front of you. And it feels almost natural to just keep digging in that tunnel, dealing with the immediate fire.
Like the example of the nurses in the hospital, the ones who kept running out of clean towels on long weekends.
Right. They were so swamped with patient care and then, boom, no towels. That's a crisis. So they tunneled. They'd run to other departments, borrow towels, hoard them, whatever it took to solve the immediate problem. Downstream fixes.
But they weren't asking the upstream question. They weren't asking, why does the laundry system always seem to break down over a 3-day weekend? They just assumed the shortage was inevitable, until finally someone stepped back, looked at the bigger picture, and fixed the underlying scheduling problem in the laundry service. Tunneling makes it really hard to hit pause and ask why.
Okay, so we have problem blindness and tunneling. The next big barrier is lack of ownership. This is where people see a problem, they might even understand it, but they feel like it's not their job to fix it, not their department, not their budget.
Yeah, there's a really neat little metaphor for this in the source material, the move your chair moment. Imagine someone's at a talk, and they're getting really annoyed because the speaker's head keeps blocking the presentation screen. Their first thought is downstream, external. The speaker is the problem, something they need to fix. But then comes the upstream insight. Wait a second, I could just move my chair. The solution is right there, totally within their control. They just needed to claim ownership.
I love that. Move your chair. It forces you to ask, what part of this can I control? But often, organizational structures almost encourage the opposite, don't they? Like we saw with Expedia, fragmented roles give people like a license to be short-sighted.
A license to be myopic, exactly. They can ignore the problems their work might be creating for someone else down the line. And when you scale this up to really big, complex social issues, taking ownership feels almost impossible. Take the Chicago Public Schools, CPS, huge system, hundreds of thousands of students. For ages, their low graduation rate was seen as, well, kind of the kids' fault, or just an unavoidable reality of urban education.
Classic problem blindness again, right? It is what it is.
Totally. But then some researchers shifted perspective. Instead of blaming students, they looked for leverage points within the system itself, and they found something incredible they could predict, with about 80% accuracy, which 9th graders would eventually graduate.
80% accuracy, just based on freshman year data.
2 key factors turned out to be incredibly predictive. It became known as the freshman on track, or FOT, metric. Factor 1. Did the student complete 5 full-year course credits in 9th grade? Factor 2. Did they fail more than 1 semester of a core course, like math or English?
Just those 2 things. Why was freshman year so critical?
Because that transition from 8th grade to 9th grade, It's a massive shock to the system for many kids. Different building, different expectations, more independence. It's a huge inflection point. The leaders at CPS realized this transition year was their highest leverage point. They could own that freshman experience.
So they decided to move their chair, metaphorically speaking, and focus intensely on ninth grade.
Exactly. They poured resources into it. They put their best, most experienced teachers with the freshmen who were flagged as vulnerable by that FOT metric. They provided targeted support right away. They went upstream, focusing on that critical transition point.
And the results?
Dramatic. The graduation rate climbed steadily. By 2018, it hit 78%. That's an increase of over 25 percentage points over 2 decades. And think about the impact of that. It's estimated to be worth something like $10 billion in extra lifetime wages for those students who got their diplomas because the system helped them succeed early on.
$10 billion generated by preventing dropouts, by getting kids on track from the start.
It's a huge upstream victory. It wasn't about reacting to dropouts later. It was about proactively ensuring a strong start.
But that $10 billion success, it's built on problems that didn't materialize. Kids who didn't drop out, which highlights that core challenge. Successful prevention is often invisible. And that brings us to maybe the trickiest barrier. Who pays for prevention? Who funds what doesn't happen?
Ah, yes, the wrong pocket problem. This is a big one. Let's look at the Nurse Family Partnership, NFP. It's a program where registered nurses visit low-income, first-time moms starting early in pregnancy, continuing through the child's second birthday. And the data is clear. NFP generates huge returns, around $6.50 saved for every dollar invested.
$6.50 back for every dollar in? That sounds like a slam dunk. Why is funding it a problem?
Because of who benefits versus who pays. The program reduces things like preterm births, child abuse, neglect, even future crime rates for those kids. But the organization that funds the nurses, maybe a local health department or a foundation, they only see a small slice of those savings directly. The big savings, they land in different pockets. Medicaid saves on NICU costs for premature babies. The criminal justice system saves on policing and prisons years later. The federal government saves on things like food assistance via SNAT.
So one entity pays the upfront cost, but the financial benefits are scattered all over the place, often to government agencies that didn't invest directly. That's the wrong pocket problem.
Precisely. It makes it incredibly difficult to secure stable funding, even for proven programs. And this whole measurement issue leads to probably the most, frankly, absurd paradox highlighted in the sources. It involves the Centers for Medicare and Medicaid Services, CMS.
The huge U.S. federal agency overseeing healthcare funding.
That's the one. They rigorously tested the Diabetes Prevention Program, or DPP, clearly an upstream intervention diet, exercise, support to prevent type 2 diabetes. The program worked incredibly well. But when it came time for the official actuaries to certify if it saves CMS money, they hit a wall.
Why? If it prevented diabetes, shouldn't it save money on treating diabetes?
You'd think so, but the problem was the program helped people live significantly longer. And according to the strict actuarial rules they had to follow at the time, people living longer ultimately costs the healthcare system more over their entire lifetime.
Wait, let me get this straight. The program was penalized financially because it was too successful at keeping people alive longer.
Bizarre, right? The prevention program was deemed not cost-saving under their rules because it extended lifespan, which increases total lifetime Medicare spending. It's counterintuitive, but that was the accounting logic they were stuck with.
That sounds completely insane. How did they ever get past that? That logic would kill almost any long-term prevention effort.
It almost did. It was overturned because one CMS actuary had the courage to basically challenge the system's premise. He wrote this powerful letter, and the core argument was, and I'm quoting loosely here, calculators are fine for figuring out payments to doctors, but calculators should not decide how long people get to live.
Wow. So the fundamental stand.
It really was. It was a moral argument against a purely financial calculation, and it worked. It led to a small but critical change in the legal language. Basically, a sentence was added saying that when evaluating prevention programs, you cannot count the cost of people living longer lives. It protected prevention funding by changing the very definition of cost-effectiveness in this context. A philosophical win, really.
So wrapping this all together then, if you, our listener, want to think more upstream, the lessons seem to be challenge problem blindness, fight that fatalism, adopt that move-your-chair mindset. Look for what you can own, even if it's small. Find those key leverage points, like the freshman year transition. And critically, push for systems that actually measure and reward preventing problems, not just reacting to them faster.
Absolutely. And remember that real systems change often starts when individuals or groups decide to take responsibility, even for problems they didn't directly cause. Like Ray Anderson, the CEO of the carpet company Interface, he famously challenged his company. Let's tell our story as if we were 100% responsible for the environmental harm we cause. When you adopt that radical sense of ownership, suddenly the upstream solutions start to become much clearer.
So for our final thought today, let's consider maybe the biggest, most expensive, most globally coordinated upstream effort ever undertaken. Fixing the Y2K bug before the year 2000.
Right. Trillions of dollars, countless hours worldwide, all to prevent chaos, to prevent systems crashing. And what happened on January 1st, 2000? Pretty much nothing. It was quiet.
John Koskinen, who led the U.S. government's effort, was asked about this anticlimax. He said, "The reason nothing happened is that a huge amount of work was done because people had made a huge amount of fuss."
It's the prophet's dilemma again, isn't it? The warning prevents the very disaster it predicted. Success looks like nothing. Exactly. No visible crisis averted, no fires put out, no downstream heroes rushing in, just silence. Problems avoided. So the provocative question for you is this. If the greatest upstream successes are invisible, if they look like nothing happened at all, how do we maintain the will? How do we celebrate the prevention? How do we thank the people who stopped the bad thing we never even saw?
That challenge, valuing the unseen, celebrating the non-event, might be the ultimate test of our commitment to truly going upstream.
Factoring can meet the cash needs of staffing companies looking to expand. Contact Chris at Versant Funding to learn if your staffing client is a factoring fit.
Welcome to Debate. We are diving today into, well, one of the most fundamental strategic choices facing anyone trying to solve large chronic issues. It's this battle between upstream intervention and downstream reaction. You know, we always seem stuck in the river, performing triage, saving drowning children, metaphorically speaking. But the strategic necessity, I think, requires us to ask, can we really afford not to go upstream to stop the systemic mechanism or, the person throwing them in the first place? Given the sheer complexity, the ambiguity, and let's be honest, the resource barriers inherent in prevention, I'm going to argue that it is strategically crucial, maybe even necessary, to prioritize that long-term systemic upstream approach.
And I guess I come at it from a slightly different angle. While the ambition of fixing the whole system, wholesale, is undeniably noble, prioritizing it blindly often ignores the very real, often frankly crippling barriers that exist. Everything from finding workable funding mechanisms to accurately measuring the outcome without introducing some severe unintended consequences. So we really must maintain a pragmatic caution here. Downstream actions provide tangible, immediate relief, and just ignoring their immediate necessity in favor of some, hazy, slow, broad upstream project is often simply impractical. And sometimes, as we'll discuss, it can be genuinely dangerous.
Okay, I see why you think that, and I definitely recognize that the downstream view is rooted in those tangible, immediate needs. It has to be. But let me give you a different perspective, maybe rooted in the potential for exponential return. The appeal of upstream action, fundamentally, is about eliminating the problem entirely, moving past the cycle of constant, frankly draining response. I mean, look at a relatively clean, contained system like Expedia. Their customer support was just overwhelmed. Calls were reaching something like 58% of their customers, mostly for really simple issues like mistyped emails leading to missing itineraries. So, by tackling this single systemic failure, building an online itinerary retrieval option, they eliminated 20 million calls annually. That wasn't just savings. They effectively eradicated a $100 million annual problem. That is the power of altering the fundamental probabilities of a system itself.
Right. That is a powerful, compelling, and I have to stress, a very contained example of a system failure. But most major societal problems are far, far hazier than missing itineraries. You frame downstream actions as just continuous response, but they are also, narrow and fast and tangible, providing necessary, immediate relief right where the need is greatest. Consider our health system. Because the U.S. model has historically been so downstream focused, meaning reactive intervention, we actually excel at complex treatments. We are world leaders in sophisticated bypass surgeries, knee replacements, advanced cancer treatment protocols. That high level of investment demonstrates the immense tangible value and, yes, effectiveness of the reactive path. And furthermore, organizations often find it easier and, frankly, far more efficient to leverage specialization. The management theorist Mark Okerstrom noted that giving specialized teams a kind of license to be myopic means they handle the resulting downstream problem very quickly, like that support team answering the call fast, rather than forcing a difficult, expensive, and often politically difficult cross-functional team to tackle the nebulous upstream cause.
Okay, I absolutely agree that specialization creates efficiency, but it simultaneously fosters this systemic, problem blindness, where we simply accept predictable negative outcomes as, well, inevitable operational costs. We have to push past that cultural acceptance. We have to look at cases where the systemic problems were massive, huge, and yet upstream work provided these extraordinary, quantifiable results that literally changed the trajectory of entire communities. Think about Chicago public schools. I mean, they were facing a catastrophic dropout rate. They realized focusing on tutoring seniors, well, that was just too late. Instead, they focused on a critical leverage point, the freshman on-track, or FOT, metric. This metric tracked credits earned and core course failures in that really critical 9th grade transition year. By shifting resources upstream to support 9th graders, just getting them on track, that single focus led to 30,000 additional graduates in a decade. The lifetime value of that systemic victory, measured in future lifetime wages, is conservatively estimated at over $10 billion. That proves the strategic necessity of fighting systemic failures, even if the work is initially slower and, messier than an immediate fix.
That $10 billion figure is staggering, I grant you, and it does make a very compelling case for seeking out those high leverage points. However, we still have to confront the inherent tension between that systemic complexity and measurable efficiency. Upstream work is often plagued by ambiguity and the sheer difficulty of accurate measurement. This often forces leaders, maybe unconsciously, to substitute hard questions for easy ones. In Boston, city engineers trying to fix damaged sidewalks struggled with this. The easy measures were obvious: how much money they spent, how many square feet of sidewalks they repaired. But these metrics completely substituted the hard question, measuring actual neighborhood mobility and safety. This risk of substituting a hard question for an easy one leads to what we might call ghost victories, or even worse, severely wasted effort. And if you disrespect that systemic complexity, well, you can trigger severe unintended consequences.
Could you elaborate on that? The unintended consequence piece? Because I agree that systemic complexity is probably the biggest measurement hurdle we face.
Certainly. Look at the ambitious ecological attempt to eradicate invasive species, rabbits, rats, and mice from Macquarie Island, way down in the Southern Ocean. They actually succeeded in removing the primary invaders, which sounds like a win, right? But this only resulted in a new catastrophic problem, an explosion of invasive weeds. Why? Well, it turns out the rats and rabbits, while definitely destructive, had been providing a degree of grazing pressure that kept the weeds in check. When they vanished, the ecosystem's second-order effects, the complex relationships between species, were underestimated. It proved pretty dramatically that solving one upstream problem can sometimes create an even worse downstream crisis.
That brings up the point about risk and efficiency, doesn't it? If measurement complexity is the first challenge, then funding is surely the second big one, right? Although before we jump fully to the financial barrier, I actually want to circle back to your measurement challenge for a second. Because the key isn't avoiding complexity, I don't think, but embracing learning and using paired metrics. While the risk of second-order effects and measurement failure is absolutely real, when upstream measures are chosen correctly, they can be powerful navigational aids. CPS, for instance, didn't just measure the quantity of graduates, they used paired measures, balancing the increase in graduates with quality metrics, specifically ACT scores and AP enrollments, to confirm their victory was real, not just, gamed by lowering standards. And furthermore, initial failure is often just part of the learning curve.
You mentioned unintended consequences. Well, Chicago initially tried a plastic bag ban, which famously resulted in the Cobra effect, stores just issuing thicker,
arguably more environmentally damaging plastic bags to comply. They learned from that pretty swift failure and replaced the ban with a more effective 7-cent tax. You just can't demand certainty before acting. You have to demand agility in learning.
I appreciate the necessity of agility, I really do. But agility is expensive, and it requires resources that are simply not often available in the current policy landscape. And that brings us squarely to what I see as the most significant structural barrier to upstream prioritization, the wrong pocket problem. This structural failure is where the entity that bears the cost of prevention doesn't receive the primary or, crucially, the immediate benefit. And that creates a massive financial disincentive.
That sounds almost self-sabotaging on a governmental level. I mean, how does that actually play out in practice?
Oh, it's often a Kafkaesque nightmare, as one official actually described it. Take the Nurse-Family Partnership, the NFP program. This is a highly effective upstream intervention. Nurses visit low-income, first-time mothers from early pregnancy right through the child's second birthday. Studies show a really robust $6.50 return for every dollar invested, primarily by reducing preterm births, reducing child maltreatment, and even reducing criminal offenses decades later. Sounds great, right? However, the initial $10,000 cost per woman, that has to be paid by a single local entity, maybe the state's health department or a local hospital system. The savings, conversely, are scattered all over the place. Federal Medicaid gets savings from fewer hospitalizations. State criminal justice systems see fewer arrests years down the line. Federal SNAP or housing programs benefit too. The entity paying the prevention cost sees almost no immediate fiscal return. Resolving this misalignment took years of negotiation in South Carolina just to create a funding stream where the benefits were eventually shared back with the entity that took the initial financial risk. The system is, well, it's fundamentally designed to punish prevention and reward reactive spending.
Okay, I absolutely agree that the wrong pocket problem is a core systemic failure that actively blocks progress. But that, to me, proves my point. We need to be more aggressive in redesigning those financial models, not retreating from the upstream fight because it's hard. And we have concrete evidence that it can be done. Look at the medical field again. Accountable care organizations, ACOs, in Medicare, they do exactly this. They incentivize prevention by sharing savings with primary care doctors and clinics who successfully reduce preventable hospital visits and major medical events. This aligns the incentive directly with the prevention effort. It's possible.
But ACOs are, well, they're an attempt to fix a system that has already deeply internalized the downstream profit model. They're kind of the exception, not the rule. And I still struggle a bit with your dismissal of the ROI question. You mentioned the moral component earlier.
And I stand by it. The reliance on ROI for prevention is, I think, misplaced. The goal is moral, not just financial. Why do we subject feeding the hungry or funding early childhood disease prevention to an ROI test that we never impose on a hugely expensive downstream intervention like emergency heart bypass surgery? There, the cost is simply assumed and paid. We should fund prevention because it is the right thing to do, regardless of whether it immediately saves the system money. Especially since prevention, by extending lives, might actually increase long-term healthcare costs in some cases. The value is not just fiscal. It's human.
That shifts the argument somewhat away from pragmatic resource allocation, which, like it or not, must still govern most decisions, especially when budgets are tight. And even if we accept the moral imperative to act proactively, to intervene early, we must address the fundamental risk of doing harm through false positives. Acting upstream involves predicting unseen futures, and that is fundamentally prone to generating false positives and potentially unintended negative health consequences, especially when dealing with complex human systems.
So are you suggesting we should just wait until the problem is undeniable and maybe overwhelming?
Now, I'm suggesting we approach early intervention with extreme caution, particularly when dealing with human health. The mass thyroid cancer screening program in South Korea is a really chilling example here. The program was designed to catch cancers early, the ultimate upstream goal, right? However, it led to a massive, immediate increase in diagnoses and, tragically, thousands of unnecessary surgeries. Why? Because the vast majority of thyroid cancers detected turned out to be indolent, latent, and essentially harmless. Patients were actively harmed by the side effects of unnecessary treatment. Everything from surgery complications to lifelong medication dependency with absolutely no compensating health benefit. That early warning system caused more harm than good, precisely because it intervened too far upstream on a problem that was often latent and harmless.
Okay, that is a critical cautionary tale about the, let's say, the misuse or misapplication of early warning systems. But when the cost of inaction is potentially catastrophic, then data-guided early warning becomes paramount. Waiting for a problem to become tangible often ensures the damage is irreparable. We have to find the right point on the stream. Look at Northwell Health. They use historical data they know that emergencies spike near nursing homes during mealtimes or shift changes, and this allows them to dynamically reposition ambulances before the 911 call even comes in. Now, they can't prevent a cardiac arrest, obviously, but they can cut crucial minutes off response time and potentially prevent death. That is proactive risk mitigation, even if it's closer to the event.
Right, but that's an excellent example of using data for dynamic downstream action, isn't it? Intervening at the last possible minute to ensure efficiency. But what about the true early warning, where the signal is much more ambiguous, like in the South Korea case you just acknowledged?
Well, I think the Sandy Hook Promises anonymous tip line offers a powerful counterpoint there. This system relies on intervening based on signs of potential violence or self-harm signals that are inherently messy, difficult, and yes, prone to false positives. However, that system has quickly led to documented successful interventions, including 46 suicide interventions and 2 major sexual assault interventions in a relatively short time. We should be willing to accept a high measurable rate of false positives, the messy ambiguity of early intervention, if the cost of missing a real catastrophe is the loss of a life, or worse, a mass tragedy. When the stakes are that high, immediate, proactive intervention becomes, I believe, a moral and strategic necessity. It feels like our discussion really confirms that upstream thinking, the ability to identify those leverage points, find sometimes non-obvious owners for problems, and really push for systems change, it's still a nascent capability, almost like an add-on utility to the human brain, as Dan Heath puts it. We have to consciously overcome this ingrained cultural problem blindness. Ray Anderson's incredible commitment to eliminating interfaces' environmental impact proves that system change requires what he called impatience for action, that demand for immediate change, but also patience for outcomes, understanding that the results, the big results, take time to accrue. The victories we've seen, like that $10 billion win at CPS, they demand that we continually take ownership of problems we previously just considered inevitable.
And yet, we must respect the inherent difficulties. While we push for that change, we have to remember that organizations naturally tend toward tunneling during crises, focusing only on the immediate downstream threat. And the political and financial fights required just to fund prevention, like those NFP negotiations we discussed, they are real, grinding obstacles, not just theoretical failures of policy design. I think the greatest successes we see are often those that manage to marry downstream urgency, that ability to react efficiently when needed, with deeply embedded upstream systems. Ultimately, real success comes when the odds have shifted fundamentally, and the right things happen by default, not because of individual passion or heroism, as the saying goes. That ensures sustainability.
So the true strategic insight here, then, maybe isn't about choosing between the river and the bank, is it? It's more about developing the intellectual agility to manage the necessary tension between providing that immediate, tangible relief downstream and pursuing complex, long-term systemic change upstream, knowing all the while that both sides of the stream have undeniable costs, risks, and, hopefully, benefits.
Distributors can benefit from the quick cash that accounts receivable factoring can provide. Contact Chris at Versant Funding to get your client funded fast. Processing companies can fund their growth using the cash accounts receivable factoring can provide. Contact Chris at Versant Funding to learn if your client is a factoring fit. Factoring can meet the cash needs of staffing companies looking to expand. Contact Chris at Versant Funding to learn if your staffing client is a factoring fit.